Support for Radio Friends comes from OsteoStrong. Improvements in bone density, strength, and power can be achieved by weekly 5-minute no-sweat sessions on their 4-spectrum machines. These isometric robotic machines safely emulate high-impact loading on different parts of the skeletal system, which stimulates activity in bone-building cells. Balance and agility can be improved by 2-minute sessions on vibration plates. Every session is supervised by a trained coach. Learn more on Facebook or call to set up a complimentary wellness assessment and session. Good morning and welcome to Radio Friends on Thursday, September the 21st. I want to introduce you to Dr. Smrita Dorairajan. Good to have you here.
Hi, Doctor. Paul. Always a pleasure.
Oh, it's our pleasure. Today we wanted to talk about vitamin D. What is vitamin D? Why is it important?
So vitamin D also is called the sunshine vitamin,
right,
because you can absorb it from the sunlight. And it is very important to maintain bone health and also muscle and also for cognitive function. And now it has benefits to improve the immune system.
Vitamin D does?
Yes, and fight infections.
We're just finding this out, right?
Yes.
I mean, it was always there, but we're, as humans, just finding out.
More new indications are coming out and more benefits are coming out from like simple vitamin D.
That it will help the immune system? And what else?
Immune system, it can prevent cognitive decline. Also, like cardiovascular risk, can prevent type 2 diabetes and certain cancers. There's been shown correlation that higher levels of vitamin D are helping prevent certain cancers.
Now, the best way to get vitamin D is with sunshine.
Yes.
The natural way. How much sunshine do you need in a day to replenish your body with the vitamin D?
So it depends on the UV index. So in a UV index of 3 or so, even 20 minutes of exposure to sunshine is enough. But in colder places and in winter climates or like more cloudy climates, then you may need few hours of vitamin D exposure.
Here in the Midwest, now in the summertime, there's no problem. If we go outside, we're getting our vitamin D. But let me ask you this. If you wear sunscreen, does that reduce the amount of vitamin D that you're getting?
Yes. Sunscreen reduces the amount of vitamin D that you're getting. Also, darker skinned people have more melanin in them. And so it has been proven that darker skinned people, unfortunately, even if they get enough sunlight, they are not converting it into vitamin D.
Oh, so I'm dark. Does that mean that...
So you should have your vitamin D checked because sometimes...
I had it checked.
Yes.
I did have my vitamin D checked and I had plenty of vitamin D in it. And
that's great. Yeah. So you don't belong to the majority because the vitamin D deficiency, nearly 1 billion people worldwide are deficient in vitamin D. So it is a very big global problem. And nearly 45% of Americans are vitamin D deficient.
45%?
Yes.
Because we don't get enough sunshine?
Yes. We are all more in desk jobs and we don't get enough sunlight. And when we go do the sunlight, we put sunscreen because it's a genuine concern that there is a risk of skin cancers,
right,
especially with fair-skinned people. So more and more, we are seeing this vitamin D deficiency.
Well, if you have a sunscreen on, do you get any vitamin D?
You can, but it prevents the full absorption.
What about if you're sitting next to a window? Are you getting vitamin D through that glass, or does that filter it out?
Direct sunlight is essential.
Okay.
Yeah.
If you're not getting enough sunlight, vitamin D supplement, right?
Yes. Supplements or like from your food. So supplement is an easy way because most people are not eating balanced food either. And there's lactose intolerance and other things. And this is mainly from milk, cheese, yogurt.
You're getting vitamin D there.
Yes. Egg yolk and fish like tuna, salmon, cod liver oil. All these are rich in vitamin D. So if you can increase the intake of these foodstuffs.
Can you get too much vitamin D?
It is just from like dietary intake. it's
Yes.
not possible, or just from sunlight, you're not going to get too much vitamin D. But when you're taking supplements, yes, sometimes when you're taking too much supplements, it can cause overload of vitamin D.
And what happens if you have an overload?
That causes too much calcium absorption, and this calcium can sometimes deposit where it's not required.
Like kidney stones.
Yes. So you don't want too much.
So you don't want to now you can't overdo it with sun, and you can't overdo it with food.
Just food.
With
yeah.
food. Where you can overdo is if you're taking tablets of vitamin D supplements.
Yes.
If you're eating the right foods and you're still taking vitamin D supplements, can that overdo it?
Only if you overdo the supplements.
Okay.
So we want to stick to about 600 to 800 international units of vitamin D. That is the recommended. So if we stick to that, you will not get the overload.
What I find amazing is that you said almost half of Americans are vitamin D deficiency.
Yes. Because more and more we are not enjoying outdoor things, and we are more indoors. And sometimes, with the winter months, we don't go outdoors at all, a lot of people.
Yeah.
And also some people are just enjoying watching movies or activity.
We are
all gadget addicted, to say the least.
You're not getting vitamin D if you're
because
sitting there.
It's part of the new generation, next generation. We used to play as children outdoors so much, but our kids, you see, are always with gadgets. So more on apps or video games or more indoor things.
Yeah.
So,
okay. So put that down. Put down the apps. Turn off the television and go outside and play with the kids.
Yes.
And get some vitamin D. The thing, it's kind of a double-edged sword there, because you hear how important it is to get sunlight, and then you hear the other hand, well, you got to make sure we don't get too much sunlight because you can get skin cancer.
Yes.
So you just need to be careful about it. But when you're putting on the sunscreen, you're blocking out the UV rays that you need for the vitamin D.
Yes.
So it's just correct. Something you got to decide one way or the other yourself.
Yes.
If people want more information, where's the best way to get information on this about the needs of vitamin D?
There are several online resources that they can just Google. Helps to see online resources.
Okay, just Google, where can I get vitamin D as far as foods and supplements? Smrita, thank you so much for coming by. I learned quite a bit today, and I did have my blood checked for vitamin D because I was concerned about that earlier this year, and mine was fine.
Kudos to that. You're getting enough sunshine.
Yeah, I guess so.
Yeah.
Thank you so much for coming by, Dr. Smrita Dorairajan from the VA hospital. Tell your husband, Anand, that we said hi. And
Definitely.
We're smiling all the time. You smile too, right?
Yes.
All right. But have yourself a good day. If there's something you'd like to hear or see, drop me an email, pepperp@missouri.edu. Bye-bye.